Are you suffering painful bladder problems such as overactive bladder syndrome, interstitial cystitis, or frequent urinary tract infections? Or are you experiencing pain in your bladder because you have overactive pelvic floor muscles, or you're having issues related to constipation that is affecting your bladder? My name is Dr. Jocelyn. I'm a pelvic floor physical therapist, and in this video, I'm going to talk about myofascial release for addressing symptoms related to painful bladder conditions. In this video, we're going to talk about what myofascial release is, how it helps painful bladder conditions, where it's performed on the body, how to find someone or who to see for myofascial release, and what differentiates myofascial release from other hands-on techniques. If you like the content in this video, be sure to like, subscribe so that you're notified every time a video is launched, and share it with anyone that may find it useful. What is myofascial release? Myofascial release is a hands-on technique that involves applying a gentle, sustained pressure on the myofascial connective tissue with the goal of eliminating pain and restoring motion, and of course, ultimately restoring function. The fascial system is a whole body system that lays on top and around every other system and all the cells in our body. Surgery, inflammation, and trauma all cause fascial restrictions that, when left unaddressed, unchecked, can ultimately lead to crushing pressure on pain-sensitive structures. Unfortunately, fascial restrictions are not seen on traditional imaging used in clinics such as MRI, CT scans, X-rays, and blood work. Therefore, conditions that are related or are created because of fascial restrictions are often missed. Three primary reasons why myofascial release is particularly helpful for painful bladder conditions is for three reasons. Number one, myofascial release helps address the myofascial restrictions within the abdominal and pelvic cavity that are placing excessive pressure on pain-sensitive structures such as nerves, muscles, connective tissue, and even the bladder. The second reason is that myofascial release really helps calm the nervous system. The last but not least reason why myofascial release is so effective for painful bladder conditions is because it helps create an awareness into habits that may not be serving you. When should you start myofascial release therapy? I think that as soon as you can find a skilled MFR therapist and are truly ready, you should start MFR. The amazing thing about MFR is it will never hurt you. We never force anything. We wait for the body to respond. The other thing to keep in mind when you are thinking about finding an MFR therapist is it's important to start when you're ready. And when I say that, when you're ready to feel. In order to heal, you must feel. And so most people see significant changes in their lives when they do see an MFR therapist. When they don't, there's a couple things that could be going on. One in particular being it's an attitude or a resistance to go into the zone that is uncomfortable and hard and hurt and painful. Not harmful pain, but therapeutic pain. So really, MFR, you can start as soon as you hear about it and you can find a therapist. My suggestion is to learn a little bit about it before diving into it, and also really take an honest inventory if you're ready to feel and you are ready to let your brakes off in terms of whatever beliefs you have today in terms of being an emotional or whatever type of person, and just allowing yourself to feel. Who should you see for myofascial release treatment? You have a couple of options. With painful bladder conditions, oftentimes there is also pelvic floor problems going on. So you could see a pelvic health specialist who is trained in MFR and has a clinic structure that allows for treating you as a whole person. You can also see, and the pelvic health specialist can be a physical therapist, an occupational therapist, or even, I don't see it often, but a DO, but most thing that I'm familiar with would be physical therapists and occupational therapists. Your other option is to see a pelvic health specialist for the pelvic floor, pelvic symptoms, and then also see someone that's trained in MFR. That could be a physical therapist, that could be a occupational therapist, a licensed massage therapist, a other healthcare provider of some sort. Doesn't have to be any of those that I had mentioned. It just depends on your state or where you live. Another thing to keep in mind is a lot of the therapists are concierge or out of network, and it's a good idea, even if you want to see a physical therapist that accepts your insurance for other things, it's really a good idea to also see a professional that is skilled in myofascial release while also going to the other therapy. Where is myofascial release performed on the body in people experiencing bladder issues, particularly painful bladder issues? Well, the philosophy is locate the pain and look elsewhere, but what we address the abdominal wall, the pelvic region, but what we're looking for are snags in the system. Snag being maybe a scar that's creating fascial restrictions and creating a pulling pattern. Maybe your head's going this way and your torso is going the other way and you're a little rotated. That can impact your body's nervous system and ability to regulate pain problems. So in addition to addressing the abdominal and pelvic region to free up the bladder and other things affecting your symptoms, maybe that's the pelvic floor too, a myofascial release therapist will treat other places as well. And people will say that while I'm treating someone up here in their head and their neck, that they could feel it in their abdominal wall or in their bladder region, the pelvic region. Why or how is myofascial release better than some other hands-on approaches? Well, I think two key reasons. Reason number one is that some other hands-on techniques like dry needling, I don't know about dry needling, but A-stim, Graston, massage, or a scraping technique, those are just too fast. They're too fast and you don't reach all of the different components of the tissue. Whereas with MFR, it's really slow and gradual, and it addresses not only the muscular component, it addresses the elastic component, but then also where the other techniques are too fast, it addresses the collagenous barrier. Once you reach the collagenous barrier, that's when sustainable changes occur and they actually last over time, whereas those other ones, you might have maybe a couple of days of relief of your symptoms and then they're back. The second key reason why I think, and I just prefer MFR, and I'm biased because I see so much better results, is that the other techniques are a force onto the system. Already you might be experiencing you're in defense mode with any other external sensations because you're in pain. And these other techniques, they're forces, so it puts a lot of people into more of a defense mode. So you're more in fight or flight, or more into that freeze mode. Whereas MFR is not a force. MFR therapists listen to your body and wait for your body to respond. So it just is really gentle and trusting and addresses the nervous system as well. Okay guys, in summary, in this video we talked about what myofascial release is, how it impacts painful bladder disorders, who to see for myofascial release, where they might treat you, and why it may be superior over other body work or hands-on techniques. If you found this content or this information useful, please press the like button, and if you want more of it, subscribe so that you're notified every time a video is launched. And then if you know anyone that could use this information, please share it with them. Until next time, I will see you guys. Again, thank you so much for watching. I'll see you on the next video.